Endometriosis, a disorder in which the tissue similar to the inner lining of the uterus, endometrium, grows outside the uterus. This results in pelvic pain and irregular menstrual cycle. Is condition treatable? Treatable by a medical professional. Does diagnosis require lab test or imaging? Often requires lab test or imaging. Time taken for recovery can last several months. Condition highlight common for ages 18 to 35. Condition highlight family history may increase likelihood. Before we delve into the topic, please like, subscribe, and share this video. Endometriosis. Endometriosis is an often painful disorder in which tissue similar to the tissue that normally lines the inside of your uterus, the endometrium, grows outside your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissue lining your pelvis. Rarely, endometrial-like tissue may be found beyond the area where pelvic organs are located. Symptoms. The primary symptom of endometriosis is pelvic pain, often associated with menstrual periods. Although many experience cramping during their menstrual periods, those with endometriosis typically describe menstrual pain that's far worse than usual. Pain also may increase over time. Common signs and symptoms of endometriosis include painful periods, dysmenorrhea. Pelvic pain and cramping may begin before and extend several days into a menstrual period. You may also have lower back and abdominal pain. Pain with intercourse. Pain during or after sex is common with endometriosis. Pain with bowel movements or urination. You're most likely to experience these symptoms during a menstrual period. Excessive bleeding. You may experience occasional heavy menstrual periods or bleeding between periods, intermenstrual bleeding. Infertility. Sometimes endometriosis is first diagnosed in those seeking treatment for infertility. Causes. Although the exact cause of endometriosis is not certain, possible explanations include retrograde menstruation. In retrograde menstruation, menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of out of the body. These endometrial cells stick to the pelvic walls and surfaces of pelvic organs, where they grow and continue to thicken and bleed over the course of each menstrual cycle. Transformation of peritoneal cells. In what's known as the induction theory, experts propose that hormones or immune factors promote transformation of peritoneal cells, cells that line the inner side of your abdomen, into endometrial-like cells. Embryonic cell transformation. Hormones such as estrogen may transform embryonic cells, cells in the earliest stages of development, into endometrial-like cell implants during puberty. Surgical scar implantation. After a surgery such as a hysterectomy or C-section, endometrial cells may attach to a surgical incision. Endometrial cell transport. The blood vessels or tissue fluid, lymphatic system may transport endometrial cells to other parts of the body. Immune system disorder. A problem with the immune system may make the body unable to recognize and destroy endometrial-like tissue that's growing outside the uterus. Risk factors. Several factors place you at greater risk of developing endometriosis, such as never giving birth, starting your period at an early age, going through menopause at an older age, short menstrual cycles. For instance, less than 27 days, heavy menstrual periods that last longer than 7 days, having higher levels of estrogen in your body, or a greater lifetime exposure to estrogen. Your body produces low body mass index. One or more relatives, mother, aunt, or sister, with endometriosis. Any medical condition that prevents the passage of blood from the body during menstrual periods